Coming up on today's episode, we thought it would be useful to share some of our pro tips and tricks we've learned while providing TMS for our clients over the past 4 years. We troubleshoot as a team, on-site, including the patient, TMS technician, and PMHNP. Hi, my name is Piper Bursmeyer. I'm a psychiatric mental health nurse practitioner, and this is Real Talk Mental Health in Vancouver, Washington, where we talk about mental health treatment from the provider's perspective. If this is content you enjoy, please subscribe to our channel and click the notification button to get notified when we come out with more videos every week. Now, for the most part, TMS for depression is very well tolerated and is quite effective. We see response rates near 80% and remission rates between 35 and 50%. Full remission is a wonderful goal, but remember, complete remission is not the only measure of success. Just imagine if your symptoms improved by 50%. That would be a huge relief. TMS protocols are not one size fits all, and sometimes it requires flexibility, collaboration, and problem solving to meet the needs of each client. Some common issues we have troubleshooted are as follows. Okay, let's start. Headaches. Headaches occur in roughly 1 out of every 6 clients during the first few treatments as the body adjusts to TMS. If you continue to have headaches beyond the first 1 to 3 treatments, there are things that we can do. Now, with our device, which is a BrainsWay device, we can adjust the helmet placement to improve tolerability. With deep TMS, you have about 2 centimeters of wiggle room where your technician can adjust the helmet placement for comfort without missing the target, which is extremely convenient. We can also treat at a power slightly lower than your motor threshold if needed, which is essentially the dose or intensity of the magnetic pulse, to ensure tolerability and continue efficacy. Motor thresholds should be assessed at least once weekly to ensure you are being treated safely and effectively. Another option with headaches is we may slow down on the tapering up process, have you pre-medicate with Tylenol or Motrin, use ice packs prior to treatment, or use numbing spray. Sometimes we just have to give it time. Headaches typically resolve on their own. Now, another thing that we may see here and there is that as we complete the depression protocol, we have to understand that it's waking up the brain, and this can result in increased anxiety. The depression protocol is waking up your brain. It's recreating connections, increasing neurotransmitter production, and this all results in an increase in emotions, some of which you haven't felt in years. And sometimes this is just in a general, sense, an increase in anxiety at a baseline because of that increased activity. We may choose a couple things on how to manage this. We can wait it out, and sometimes it resolves on its own, which is quite frequent. If the symptoms become more intolerable, we may add the anxiety protocol on the right side, or may even consider theta bursts. We can also adjust medications to treat anxiety as well. We have plenty of options. We also see sometimes as the brain wakes up and neurotransmitter production increases that high doses of certain medications can actually contribute to anxiety, and sometimes we can lower your doses of medication and that resolves the issue. So the next topic we want to talk about that we troubleshoot is pain and discomfort in general. These are not desirable things, and sometimes it's the reality, but frankly, we like to do everything we can to avoid it. So one thing we can do is consider decreasing the strength of your treatment, as it may not be needed at that dose for you. We might put a thin piece of styrofoam between the helmet and your head in the BrainsWay device, which can help make the treatment more comfortable without compromising your results. We can again consider theta burst, which is a different type of protocol and different type of magnetic burst, or changing to a figure 8 coil. And the BrainsWay device is a different technology than a figure 8 coil. And a figure 8 coil can sometimes be more tolerable as the direction of the figure 8 coil is very, very exact. And the BrainsWay device can be more all-encompassing. Words that we can sometimes hear is diffuse, when in fact it hits a lot of areas in the brain and is very robust and effective, but sometimes people just can't tolerate that. So another thing that we often troubleshoot is late responders. So late responders, it can be discouraging for clients if they are in this category. Experienced TMS medical professionals will likely offer additional treatment or alternative protocols for people who are not getting optimal results by week 5 or 6. These are who we call late responders. We also consider, some of these clients to be treatment resistant as well. Now, the difference between a late responder and a treatment resistant may be that a late responder is getting results, but not until very far into their treatment, week 5 or week 6, and they're about to finish up, as compared to a treatment resistant client, which is just not getting results. Oftentimes, the solution for both of these clients can be the same, but there's substantial evidence for up to 9 weeks of treatment, even though most insurance companies tend to only cover 6 and possibly 7. Having an experienced medical professional and TMS authorization team working to get approvals will increase the likelihood of additional TMS treatments being covered by insurance. Additional treatments often result in achieving remission or getting very close to it. I kind of like to compare this to the strongman contest. Remember that event in the strongman contest where he pulls the semi with a very thick rope and he gets that semi rolling and the wheels finally start turning, the tires do, and you think to yourself, don't drop the rope. He's working so hard. And I like to compare it the same. Clients have invested 4 or 5, 6 weeks of treatment, and we don't want them to drop the rope. So we really want to focus on increasing the weeks of treatment. And frankly, most of the time we can get 15 more treatments, which is 3 weeks. Now, another group we find is that maybe a client has responded very well to TMS, but the results are not sustaining. So this could be clients who have partial response to TMS or a very robust response, but sometimes we can't tell which ones are going to sustain and not others. We haven't figured that out quite yet. But the clients we've seen lose this benefit tend to respond well to what we consider, you could call them booster treatments or maintenance treatments. We found that also extending the length of time of TMS treatment, not necessarily with consecutive treatments, but just overall length, can help maintain the results. So what I mean by that is, let's say insurance offers us 36 treatments, and that's over the course of, let's say they have the authorization over the course of 12 weeks. We may consider extending the taper after 4 weeks of the TMS treatment. So let's say you're responding after 4 weeks, you're feeling really good, but as we continue with treatment, let's say we do a taper and we decrease it and you're starting to notice that you're struggling, we may continue to extend that over the course of time because we want to sustain your effect. Now, we also have clients that just seem to do well with maintenance treatment. They might need once weekly or once monthly treatment, and that is okay. Insurance isn't always on board with this, unfortunately. We see this effect in clinic. We're looking forward to the data coming out regarding this, but sometimes we have to do it pro bono if we need to sustain results, because frankly, after a patient has sacrificed that much, as a clinic, we'll do whatever we can to help them keep those results. It's really important to us. Now, in general, to maximize your results, you have to start a probiotic in general for gut health. It's kind of a basic thing. Really focusing on getting a probiotic on board, cutting out significant amount of fast food, high sugars or chemicals in your diet. Now, it doesn't mean you can't eat any of those things. It just means moderation is key. So in that piece of maximizing results is improving gut health. There's a lot of serotonin production in your gut. Making sure your sleep is stabilized and that your sleep is pretty sound and stable. Completing medication optimization prior to starting TMS. This is really important because we want to make sure there's no medications on board that are getting in your way that could be contributing to depression, like high doses of benzodiazepines. To maximize results, you're going to want to check in with your TMS tech and provider often to determine if medication changes or TMS protocol changes need to be made. And this is what's so helpful when you have a provider and technician on site, is the idea that they're working together to maximize your results and collaborating frequently. Remember that TMS was studied in moderate depression, but in the States is only approved for severe treatment-resistant depression. So don't be surprised if it takes some troubleshooting and advocating to get the response you desire, because that remission rates we see and the response rates we see are typically with moderate depression. And what we have found is that sometimes the clients that have suffered from 20 or 30 years history of depression just require a little bit more TLC and length of treatment. And that's just fine. We can work together to make that happen. Your mental health care should be individualized and specialized, and that still applies to TMS. Make sure to find yourself a TMS clinic who does everything in their power to maximize your results instead of just treating you like a number in the chair. You deserve top-notch care. That's really important that you feel very well cared for. Now, I hope these tips help, and for more information on TMS treatment, check out our channel and be sure to subscribe. We come out with videos every single week, and we're happy to share our knowledge. We'll see you soon.